You could see them rolling through Jackson, Mississippi on Wednesday, and then Montgomery, Alabama, and Baton Rouge and New Orleans later this week, and Texas after that. Mayday Health, a nonprofit group, has been traveling through 14 states that ban abortions, targeting college campuses with their mobile billboards. They say they launched this campaign to make sure people know, despite what these 14 states may say, that people who want abortions can get them in all 50 states by mail. That's because the Justice Department still says that it is legal to mail the 2 pills used for medication abortions across state lines. The Mayday trucks come complete with QR codes that direct people to resources about how to get abortion medications sent to restrictive states. As the fight over abortion access shifts gears from surgical abortions to the method used in more than half of U.S. abortions, which is pills, advocates and residents of restrictive states are finding new, innovative ways to fight back and spread the word that the battle isn't lost yet, even though it seems increasingly uphill. In Texas, where pretty much all abortion is illegal at any point in pregnancy at the risk of a felony, one lawmaker is trying to take things a step farther. State Representative Steve Toth recently introduced a bill that would ban websites from advertising or selling abortion medication. The bill specifically calls out Plan C, Hey Jane, and Aid Access, all groups that help people access abortion pills, kind of like what Mayday Health is doing with its QR code. This proposed Texas bill would also let individuals sue the people who maintain these websites. These sorts of bills are usually challenged in court, but not before they frighten state residents. And at this point, the protracted and splintered fight over reproductive health care isn't just freaking out people, it's scaring companies, too. Just yesterday, Walgreens announced that it would no longer provide abortion pills in 20 states, even though in some of those states, access to that medication is still legal. In January, the chain said it would sell abortion pills through its retail pharmacies. But when a group of 20 attorneys general wrote to the company to threaten legal action, Walgreens reneged on its plan. The attorneys general told Walgreens that they were just trying to uphold the law and protect the health, safety, and well-being of women and unborn children in their states. Joining us now is Irin Carmon, senior correspondent for New York Magazine, who closely covers American abortion law and politics. Irin, it's great to see you. Thanks for being here. I'm sorry, this is where we are as a country and what we're given to talk about. But, you know, what is your thinking about Walgreens' decision, and how likely do you think it is that this pressure from these state attorneys general is going to make, you know, pharmacies like, I think, CVS, Albertsons, Rite Aid, Walmart, Costco, Kroger cave to the same kind of pressure?
So to put it into context, this is an enormously safe medication.
Yeah.
It's been studied over and over again. In fact, it is 18 times safer for a person to take the abortion pill than it is to give birth. Okay, it's generally safer to have an abortion than to give birth, but it is even more so to take a medication abortion. But in fact, until now, you haven't been able to get it at pharmacies because abortion and everything around it is regulated in ways that don't have anything to do with medicine and have everything to do with politics.
Yeah.
So when the Biden administration tried to enlarge these possibilities, in part recognizing that access is so much more complicated, trying to make sort of more avenues, given that a third of the states have banned abortion, it's like a game of whack-a-mole.
Yeah.
We know they've already made clinics a hell to walk into.
Yeah.
We know they've shut them down in all of those states. And so now even the prospect that people might be able to get an abortion pill without having to wait weeks anxiously to figure out if it's going to get there through the mail, because we know the mail is complicated and not everyone has a stable address. They don't necessarily feel comfortable walking into an abortion clinic. So lest anyone access an abortion without shame, anxiety, stigma that has nothing to do with medical necessity, that's where these AGs come in. And so they are trying to bat down any attempt by the federal government to make people's lives easier when they're trying to access this procedure.
And terrify those websites, if you will, that or scare them into effectively shutting themselves down, I guess, that are trying to help people access the medical the medication that they need. I mean, the idea that you would prevent a website from being available to women in states like Texas, it feels like we are not in America anymore, that we are having restricted websites when women are in medical emergencies. Absolutely.
You know, a lot of these websites actually started because they recognized where things were going. They saw that there was a danger. They saw that there was an access problem. Now, these U.S.-based websites, they only work where abortion's legal. Then you have aid access that works in states that are not illegal. They're overseas. So it's a complex picture. But it's sort of what anti-abortion people recognize is they can't raid everybody's medicine cabinets. God, they wish they could.
Yeah, or their mailboxes.
They could.
Yes.
And you can also, this is an important thing to note, you can get this pill without being pregnant if you get it through one of the online pharmacies. And so some people are stocking up in advance because they don't know how this access picture is going to change. And so this Walgreens move needs to be seen in the context of them trying to sort of shrink the possibilities that somebody could get the care that they need.
Yeah. I mean, we're waiting for the Texas ruling from Judge Kaczmarek, which could shut off access to mifepristone across the country.
Yeah.
The other abortifacient pill, misoprostol, is used technically for ulcers. It would be harder to ban that as well, but it is used for abortions as an off-label use. And I wonder if you think if they're successful in banning mifepristone, is misoprostol next? Is the option of medication abortion basically taken off the table for American women?
So I think that's a protocol that's used in a lot of countries. It's not going to cover every single person who needs an abortion.
Yeah.
For example, if you need an abortion later in pregnancy, medication is not going to help you.
Right.
So I think even though these are game changers, it's always good to remember that not everybody is going to be able to get the care they need this way. In terms of, one of the things we're really learning since Dobbs is that you can't really take abortion out of general medical care without harming a lot of other people. So these are drugs that are sold, for example, in Mexico. You can get them over the counter. They're ulcer medications.
Yeah.
If you are having a miscarriage, if you are, in some cases, having an induction, these are pills that are used in all kinds of contexts. There's nothing that says, like, this is for the bad women and this is for the good women, much as the anti-choice would like to kind of segment that. And so I think that they would face a problem if, like, let's say that this makes its way up through the courts and, Judge Kaczmarek, who came from the Alliance Defending Freedom, does what everybody thinks he's going to do, but also it has to get upheld and the administration has to interpret it and so on. More and more people are understanding that you really can't disentangle abortion from other kinds of medical care and that it winds up punishing people in all kinds of medical situations.
Who have nothing to do with any of it. Irin Carmon, it is complicated and it is ongoing, shall we say. It is great to see you. Thanks for your time and your great reporting on the topic.
Thank you.